Hello, and welcome to Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore and answer and hopefully intrigue you to think about alternative methods to help explain and treat medical conditions and to help you achieve and maintain health. In our last show, we took a look at the adrenal glands, and if you saw that show, you learned how this very small organ sitting on top of your kidneys deals mostly with stress and how your body responds to a wide variety of stresses that we all deal with every day. That show focused not only on knowing what stress does in your body, but how you can take better care of yourself by reducing your stress levels and living a more healthy life. One of the primary reasons we are wanting and in fact needing to reduce stress is because it can lead to so many other severe and systemic medical conditions. For some people, these conditions can cause a downward spiral that becomes out of control and will have a profoundly negative effect on your health for the rest of your life. Speaking of health, let's define what I believe health really is. Health is not merely the absence of disease, but rather a homeostatic balance of the systems and processes of the body. It is the harmony of the 12 systems in the body that allows it to function in a healthy manner and hopefully prevent disease. Again, this show has been designed to provide you with information that you can use and be better informed about achieving and maintaining your health. Many times there are alternative methods available for a given condition, and it is my desire to inform you about these treatments and therapies as we all strive and seek better health.
We don't just do things bigger and better, but smarter and faster. We are pace setters, trend makers, caretakers. A community serving a greater community. Turning homegrown talent into a hometown workforce to be reckoned with. At HCC, we don't just keep Houston relevant. We prepare our students for success. HCC, smart decision.
It's exciting and bold, yet classy and comfortable. It's the Tom Felicia Home Collection that puts the finishing touches to your perfect living environment. James Craig Furnishings in Houston offers the Tom Felicia Home Collection, along with other fashion-forward home furnishings, fit for every lifestyle. They offer the designs you want and the service you deserve. Visit James Craig Furnishings.
So, April.
Yeah?
You know your charger's still using energy when it's plugged into the wall, right?
Yeah, but that's not my charger. I don't even have a cell phone.
Millions of kids are using their energy wisely. What's your excuse?
I am making my emergency kit. I want to be prepared just in case.
Oh, my friend Mia made a kit with her family. Everyone help. They packed flashlights and batteries, water, food, a radio, and put it where they could find it rapidamente, quickly.
I guess I should take my canoe out of there, huh?
Look, Rover.
Help your family get ready for an emergency. Learn more at ready.gov/sesame.
Welcome back. Today in the news, we're first going to look at a new study from the Siteman Cancer Center at Washington University School of Medicine and the Barnes Jewish Hospital in St. Louis, Missouri. And this study shows that regular long-term physical activity is associated with a lower risk of colon cancer mortality. Basically, this study continues to add to the growing body of research that tells us that exercise is good for us, especially with regards to modifying cancer risks. This study appeared in the December issue of Cancer Embryology, Biomarkers, and Prevention, and according to the lead author, Dr. Kathleen Y. Yotlin, it shows that physical activity can make diseases less deadly and possibly even prevent cancer from occurring. For those of you who are regular viewers, you may remember that we had a show not long ago about the benefits of exercise. We went to a local gym and visited with several people who stated that they regularly receive great benefits from exercise, and we now learn that there's another great reason to exercise regularly, which is to possibly prevent or at least reduce the risk of colon cancer. Our second news story confirms what I have been telling my own patients for many years. There is a diet that you can find in your local bookstore or even on the internet called the Mediterranean diet. It's been around for thousands of years, but it's not your typical diet. Rather, it's a lifestyle way of eating. According to a new study published in the December 22nd issue of the American Journal of Clinical Nutrition, older adults who stick closely to the traditional Mediterranean diet experience slower rates of cognitive decline as they age. The Mediterranean diet is not only a heart health diet plan, but also one that fosters a healthier functioning brain, according to Christine C. Tangney of the Department of Clinical Nutrition at Rush University Medical Center in Chicago. The Mediterranean diet consists of using olive oil and eating fish, nuts, fruits, and vegetables, and a moderate amount of wine. But it is a low diet in dairy foods and red meats. And for those of you who routinely eat foods of the Mediterranean diet, they experience a lower prevalence of stroke, hypertension, high blood pressure, depression, and cognitive disabilities. So here again, we're learning from a research study that our diet can have a profound and possibly positive effect on our long-term health. Or if we look at it in the opposite way, this study can also show that we can have a profoundly negative effect on our bodies and therefore our health if we consume the wrong type of foods. And this leads me to our discussion for today, which is inflammation. We're going to take another short break, but when we return, we're going to be looking at the effects of inflammation and the effects it has on our bodies, and how the things we eat and the things we do to ourselves can cause tremendous damage to our inner structures, which can lead to disease and even death. So stay tuned, and after this short break, I believe you'll learn a great deal about better health.
We are united by more than just geography. We are a community within a community, essential to the common good, locally driven and globally demanded, proud of our diversity and focused on the future. HCC is the opportunity that leads to more opportunities. HCC. Smart decision.
The forest is special, magical, and very precious. One careless act caused by people, and its beauty could be gone for a lifetime. Protect our friends in the forest.
We'll all pitch in.
Only you can prevent wildfires.
To find out more, log on to SmokeyBear.com.
I'm Jeremy Call, and I made suction tires. Wait, what? Wait. I used a rivet gun to connect the suction cups, and then I just connected it to the tire. I got the idea from an octopus because of the suction cups, and I don't know.
Anything's possible. Keep thinking. Get started on your invention at inventnow.org.
Explore new worlds. Read. Visit literacy.gov.
Welcome back to Better Health. I'm Dr. Stowe. The first thing we need to learn is exactly what inflammation is and what it is not. By definition, inflammation is part of a complex biological response of the immune system on the tissue in our bodies to harmful stimuli such as a cut or bacteria or virus, something that irritates us. Inflammation is a protective attempt by our body to remove or stop the harmful stimuli from continuing to do damage to our tissue. It is also important to understand that inflammation and infection are not the same. Where infection is caused by a microorganism, inflammation is a response by our body to that organism. Without going into a great deal of science or medical terms, what you need to know is that there are two basic types of classifications of inflammation. The first is what is called acute, which deals with the immediate response to something that is bothering our body. For example, a cut from a kitchen knife or an infection in our sinuses that leads to sinusitis. The other type of inflammation is termed chronic inflammation, and it is the type of inflammation that will be focused on our show today. Please understand that acute inflammation is our friend. Without inflammation, wounds and other pathogens or harmful stimuli that invade our body would never heal. It is this acute inflammation that makes our body start the healing process. By the same token, it is this acute inflammation that does stop when it is supposed to. When the acute inflammation becomes chronic, that process continues to damage our tissue, and it is this damage of our tissue that can lead to devastating effects on our health to a point that it actually can compromise our survival. This chronic inflammation has now become a disease. But what in the world causes normal biological response to fight infections and other harmful stimuli to turn against our own body and become this potential life-threatening disease? Well, that's a great question, and the answer is less straightforward. As a matter of fact, science really doesn't know what the answer to that is and why acute inflammation doesn't stop. But they're searching for the answer. I personally believe that there is an explanation as to why this chronic inflammation and how it can be related to so many systemic diseases. And that potential answer lies with the diet of the average American. It's called SAD, S-A-D, and that stands for the Standard American Diet. You see, when we eat a diet high in fats, meats, processed foods, and dairy, but low in fruits, vegetables, nuts, and a small amount of grass-fed meat, our genetic makeup doesn't process these foods very well. In other words, our gut, our intestines that processes this food has a difficult time doing the job. And if our gut can't do its job correctly, then we have some serious issues. In another show, I will go into more detail about the gut and how and why it is so important. But for now, just remember that without a normal functioning gut, our immune system will be compromised, and it is our immune system that protects us in many ways, and one of those ways is by starting and stopping inflammation. And by the way, depending on which literature you read, 60 to 70% of our immune system comes from our gut. So now let's turn our attention back to the chronic inflammation. And although we may not know what causes it, you might So what? So what if I don't know what causes this chronic inflammation and it's in my body? I don't feel anything. It's not something I can feel, so who cares if I have this chronic inflammation? Well, this is the part of the program you should pay particular attention to. On the screen now, I want you to look at the potential and probable diseases that you might have going on in your body right now, many of which can and will kill you if you're suffering from this chronic inflammation. Let's look at these for a moment. Cancer, cardiovascular diseases, which includes high blood pressure, arthritis, and diabetes, just to name a few. Take a moment and ask yourself, which one of these diseases do you want to have? Obviously, the answer is none of them. No one wakes up and says, hey man, I just can't wait to get this cancer. But that is exactly what chronic inflammation can cause. Are you sitting there thinking, okay, there's no way something that I can't feel or see can be causing this dreaded disease? Well, let's take a look at a little research. From the Johns Hopkins Medicine, chronic inflammation initiates and speeds along the process of atherosclerosis. From the Journal of Nutritional Biochemistry, obesity and a zinc deficiency, due to our diet, caused a deeper inflammatory status. From the Journal of Clinical Endocrinology and Metabolism, the proper balance of EFAs, again from our diet, may be beneficial in patients with active chronic inflammation. And the research goes on and on. The bottom line for all of us is that chronic inflammation causes pain and suffering. It causes systemic diseases, and it can indirectly kill you. So what are you to do? First, I would tell each of you to go to your doctor and ask him or her for blood tests that measure inflammatory markers. One is called CRP, which stands for C-reactive protein, and the other one is called ESR, which stands for erythrocyte sedimentation rate. Both of these tests can determine if you have any inflammation in your body. The problem with these tests, however, is that they don't tell you where the inflammation is coming from. So if you have an elevated inflammatory test, now the real work begins to determine how, where, and why there's inflammation inside of you. But having the test, you can then at least start the process of discovery and hopefully find the cause and then treat the condition, which will ultimately lead to better health. There's one more segment in our program, and it's called Ask the Doctor. This is where you, the viewing audience, can ask me questions. So let's take one last break and I'll be right back.
The future of higher education and a skilled workforce for our great city starts here. Welcome to Houston Community College. We are opportunity. We are essential. We are hope. We are a gateway to education, to jobs, and to the future. There has never been a more important time for community colleges in our country's history than now. At HCC, we are redefining what a community college can be for our students and for our community. Our reach is extraordinary. Our outcomes are revolutionizing how students approach their education and how employers meet their needs for a highly trained and skilled workforce. HCC is recognized across the state, the U.S., and even internationally for both what we deliver and how we deliver it. With the future workforce requiring more post-secondary education, we are well positioned to help both students and their future employers succeed. And we're making it easier for our students. With campuses across the community, creative scheduling, and innovative payment options, education has never been this accessible. At HCC, we are locally driven and globally demanded. We turn homegrown talent into a hometown workforce. We are proud of our diversity and focused on the future. We are a community within a community, essential to the common good. So when you think about what's next, when you think about what can be, think HCC. We are the opportunity that leads to more opportunities. HCC. Smart decision.
So, Malcolm, you do know that energy savers last 6 times longer than ordinary light bulbs.
This isn't my room.
It's Baron Davis's. Baron Davis, the basketball player? This is his room? Yep. Interesting, because we have Baron Davis right here. Baron, do you live here?
No.
I don't mean that, Baron Davis.
Millions of kids are using their energy wisely. What's your excuse?
The magical thing about using energy wisely is that anyone can do it. Use energy-saving light bulbs, Energy Smart Power Strips, and turn off computers and game systems when not in use. Get together and make a difference. Learn what you can do at energy.gov/tink.
Welcome back to Better Health. I'm Dr. Stowe. We received a very interesting question from the last show we did on the adrenal glands. Someone writes, I would like to get the adrenal test you talked about, but my insurance won't cover the test, and even if it did, I probably couldn't afford the supplements you talked about someone having to take to address the problem. I believe I might have an adrenal deficiency and I want to be in better health, but if I can't afford the test, is there anything I can do? That was an incredible question because it's one that everyone sometimes has to address in this real world where there are so many people who are wanting better health, but with the economy and the workplace the way it is, they just can't afford the basic necessities of life, let alone a specialized lab test. So here's what I recommend. First, you should probably look at dietary changes like the ones we just spoke about in this segment. If you can boost your own immune system with better diet, you will probably start to feel better almost immediately. Second, almost every patient I've seen is dehydrated, and dehydration can lead to a variety of diseases. What I tell my patients is to weigh themselves and then drink approximately 1/2 of their body weight in ounces every day. So if you weigh 140 pounds, you would drink approximately 70 ounces of water a day. Third, every day, especially in the afternoon, try to take about 15 minutes and just sit and do nothing. Relax. I know this is tough, but relaxation is free and you can do it, and it has tremendous benefits and effects on the body. Lastly, remember that there are things that you can control and things that are simply out of your control. If you can't control something, then worrying about it isn't a wise move, and it's a waste of energy and time. It adds stress to your life. If, on the other hand, you can control the outcome of an event, then simply find a solution, implement that solution, and then forget about it. Some of these things that I've talked about aren't easy, but at least you can start along this journey and hopefully make a difference in your stress levels and therefore your health. Well, this ends this episode of Better Health. I hope you've enjoyed the show. It is my desire to educate individuals about a variety of conditions and treatment options that exist outside of conventional medicine. I should also state that I am in no way making any type of diagnosis for any condition. All of the comments on the show are for informational purposes only, and any condition that you have or think you might have should be discussed with a qualified healthcare professional. Again, I encourage you to send me any questions you might have regarding today's topic or any other health-related topic that you might have. And as time permits, I'll answer your questions on the air. Till our next show, take care, enjoy life, and live healthy.